Dear participants, greetings. I would like to thank the organizers for the opportunity to participate in the Berlin International Conference on Research in Life Science and Healthcare. My name is Dr. Daria. I am PhD Associate Professor at the Department of Pediatrics of Odessa National Medical University. I am from Odessa, Ukraine. Allow me to present topic clinical significance of high-frequency chest wall oscillation in the comprehensive treatment of community-acquired pneumonia in children. Respiratory diseases remain among the leading causes of morbidity in children for all age groups and represent a persistent challenge in pediatrics. Pneumonia is one of the most common manifestations of respiratory tract involvement and continues to pose a significant medical and social event in the 21st century. The need to explore new approaches to improving pulmonary function arises from ventilation and gas exchange impairments in children with community-acquired pneumonia. High-frequency chest wall oscillation presents new opportunities for enhancing pulmonary function in the patient population. Conventional therapy is often insufficient to fully correct pathological changes in respiratory mechanics and mucociliary clearance. High-frequency chest wall oscillation facilitates mucus mobilization through vibration and enhances both functional and volumetric parameters of the lungs for applying positive pressure compression, thereby improving pulmonary function. High-frequency chest wall oscillation is widely utilized in the treatment of cystic fibrosis, bronchiectasis, atelectasis, muscular dystrophy, cerebral palsy. The novelty of high-frequency chest wall oscillation method is supported by the insurance of Ukrainian utility model patent methods for assessing the effectiveness of treatment for acute respiratory diseases in children. Study aim to evaluate the effectiveness of high-frequency chest wall oscillation as an adjunct to comprehensive therapy in children with community-acquired pneumonia. Objectives: to assess the impact of high-frequency chest wall oscillation on the dynamics of clinical symptoms and pulmonary function parameters in children with community-acquired pneumonia. Pulmonary function indicators evaluated, for example, volume parameters like vital capacity, forced vital capacity, and others, flow parameters like peak expiratory flow, and others. Study design: an open-label, comparative, prospective, randomized, single-center clinical trial evaluating the effectiveness of high-frequency chest wall oscillation as a part of comprehensive therapy for community-acquired pneumonia in children. The study was conducted at the Specialized Care Department for Older Children of the Odessa Regional Children's Clinical Hospital. Children were divided into groups. Main group consists of 54 patients. They received standard therapy in combination with high-frequency chest wall oscillation using the West Airway Clearance System Model 105, manufacturer Hillroom, USA. Control group consists of 53 patients. They received standard therapy only according to local clinical protocol for treatment community-acquired pneumonia. Inclusion criteria: confirmed diagnosis of community-acquired pneumonia, moderate severity with uncomplicated clinical course, age between 6 to 16 years, and informed consent. Exclusion criteria: fever above 38 degrees, signs of severe intoxication, complicated clinical course of pneumonia, eczema and purulent skin conditions, lack of informed consent. Manufacturer's contraindication to high-frequency chest wall oscillation like head or neck trauma, active bleeding with hemodynamic instability. Methods: All children underwent a comprehensive clinical evaluation, including medical history, physical exam, laboratory and instrumental investigations. Pulmonary function was assessed using spirometry in accordance to ATS-ERS international standards. The study employed a hardware-based airway clearance method like airway clearance system. Oscillation modes were developed based on the child's age, body mass index, and constitutional type. The modes varied by 3 key parameters. For example, vibration frequency, compression pressure, and procedure duration. Each child received 10 high-frequency chest wall procedures. A test procedure was performed at the beginning of the treatment course to assess individual tolerance. Subsequent procedures were carried out with a gradual increase in vibration, frequency, pressure, and duration to ensure optimal effectiveness and safety. In the context of comprehensive therapy that included high-frequency chest wall oscillation method, the respiratory rate in children of the main group normalized more rapidly than in those of control group as illustrated in the graph. By the end of the treatment course, dyspnea persisted in only 2.78% children in the main group compared to 15% in the control group. The high-frequency chest wall oscillation method significantly reduced the frequency of productive coughing. Starting from fourth procedure, children in the main group exhibited a noticeable decrease in sputum production. Auscultation in children with community-acquired pneumonia revealed presence of fine moist valves. The application of high-frequency chest wall oscillation led to marked reduction of the moist valves by the 5th day of treatment in the main group. Analysis of pulmonary function test dynamics after 10 procedures with the West in the main group revealed a significant improvement in 5 key parameters. First parameter, vital capacity, forced vital capacity, forced expiratory volume in first second, and maximal expiratory flow and peak expiratory flow. In contrast, the control group demonstrated a less pronounced response to penicillin therapy with improvement observed in only 2 parameters, vital capacity and maximal expiratory flow. A summary assessment of the effectiveness of high-frequency chest wall oscillation in the comprehensive treatment of community-acquired pneumonia in children is presented on this slide. In the main group, a more favorable clinical course was observed compared to the control group. Group included reduction in the intensity and productivity of cough, decrease the number of moist valves, improvement in pulmonary function. So, the results confirm the clinical effectiveness of high-frequency chest wall oscillation in children with community-acquired pneumonia as evidenced by improvement in clinical symptoms, enhancement of pulmonary function indicators, key advantages of high-frequency chest wall oscillation, simple and safe to perform, well tolerated by pediatric patients, compatible with other air clearance techniques. Given the potential for complications and adverse outcomes in community-acquired chest wall oscillation is recommended for routine use as a part of comprehensive therapy in pediatric patients. Thank you so much for your attention.